Hi guys. Oh, come on, really? Am I hooked in here somehow? Yeah, somehow having a little bit of technical difficulties. There we go, I think. All right, so today, as you know from the title, I'm going to be talking about stillbirth. I've been avoiding this topic for the longest time, okay? I've been avoiding because it's just not it's not an easy topic to talk about, but it's also not easy for people to go through. And it needs to be talked about more, to be quite honest. It needs to be talked about more because women have a tendency to think that it's only them and why me, and am I the only person that's suffered through this, because it's got to be, you know, a feeling of I feel like I'm the only one, like the mother that goes through it feels like I'm the only one that's ever gone through this, and that is so far from the truth. This is a common thing. Okay, I used to work in OB. I helped mothers deliver babies. Um, there was one mom who she was pregnant with twins. She lost one of them. Another baby we lost, the mom lost, um, because all the organs were on the wrong side of the body, of the baby's body. So, um, yeah. So the first thing I want to tell you, for those of you who have been through it, the first thing that you need to know, and hear me good, you had nothing to do with it. It is not your fault. It is not what you did. It is not what you ate. It's not the fact that you worked out. It is not the fact when you were pregnant. It is not the fact that you had too much soda one day. It has nothing to do with anything like that. I'm going to tell you what I worked under doctors, I worked under nurses, I worked under med techs, and when you're being taught by them, if you're interested, right, you absorb everything like a sponge, like you just soak everything up like a sponge. And I remember one of my doctors saying, not my personal doctor, a doctor I worked with, said more often than not, it's because nature is, I don't know how to say it, taking care of a problem, because it's like Mother Nature's way of saying, no, this situation is just not viable. So there's chromosomal reasons, deformities. There's too many chromosomes. There's, I want to say it's called encephalopathy. I'm not sure how to pronounce that word. But, there's abnormalities with quite a bit of the brain didn't form. You don't have the power to fix that, right? So you have nothing to do with that. Just like if you have something wrong with you, you have a disease. You can't blame yourself for that. There's genetic reasons, there's chromosomal reasons, there's abnormalities in your body that you didn't know about until this situation happened. So you can't control that. You can't control your body. You can't, right? Logically, we know that. So, yeah, I can't remember exactly how he worded it, but he said this is Mother Nature's way of, you know, um, not allowing this to continue because there's too many problems going on. There's just issues that would not allow that child to be viable. So you can have a rainbow baby, which is the baby that you have after you lost a baby. You can have a perfectly healthy baby because those issues are not an issue anymore. And I know of one lady in particular, who went to a fertility specialist, and I believe she's able to, because they'll find out, what they'll do is they have extra resources that your doctor doesn't have. Okay. They've got resources that an OBGYN does not have. They can do testing on a fetus. They can do in vitro fertilization. They can do all types of things that your doctor just it doesn't have the ability to do. And they can do all types of testing on the mom and the dad to see if there's anything abnormal with either one of you or both of you that would cause this problem to continue. There's RH factor, where, let me see something here. So the mother has a different blood type than the child, and so the child, this happens too. So her body wants to eliminate the child because because your blood type is completely different. It sees the baby as an invader, like something foreign is in here that we don't want to deal with. Okay. Um, So Rh factor is when the Rh antibodies made in a woman's body can cross the placenta and attack fetal blood cells. This can cause a serious type of anemia in the fetus, in which red blood cells are destroyed faster than the body can replace them. Red blood cells carry oxygen to all parts of the body. And for women who have been through that, they have received a ROGAM injection, and that is supposed to help with that particular situation. So, according to, and another thing, this happens more often than women realize. So you're going through it and you feel like you're the only person. This happens a lot. This isn't something women talk about. However, women are starting to talk about it a lot more, and thanks to social media like Instagram and YouTube. Women are telling their stories and sharing their stories. So if you were to go through that and you checked online on YouTube, you will see many stories about women who have been through it. So no, you are not alone, and no, this isn't as rare as it seems. Okay, this isn't as rare as it seems. A lot of women have been through this, and a lot of women have come out on the other side where they have had healthy babies, and some of them have had to go to fertility specialists because there were just a multitude, or 1, 2, 3, 4 miscarriages in a row, and so they need help conceiving a healthy baby, and that's where in vitro would come in. Stillbirth is typically defined as fetal death at or after 20 or 28 weeks of pregnancy, depending on the source, although I know of some women who have had it before that. Okay, so I don't know why they're saying that, because it can happen before that time frame. It results in a baby born without signs of life. A stillbirth can often result in the feeling of guilt or grief in the mother. The term is in contrast to miscarriage, which is an early pregnancy loss. Well, that's probably where the comparison comes in. And sudden infant death syndrome, where baby dies short time after being born alive. Often the case is unknown. Causes may include pregnancy complications such as preeclampsia and birth complications, problems with the placenta or umbilical cord, birth defects, infections such as malaria or syphilis, and poor health in the mother. Risk factors include a mother's age over 35, smoking, drug use, use of assisted reproductive technology, and first pregnancy. Stillbirth may be suspected when no fetal movement is felt. Confirmation is by ultrasound. Worldwide prevention of most stillbirths is possible with improved health systems. Around half of stillbirths occur during childbirth. With this being more common in the developing than developed world. Otherwise, depending on how far along the pregnancy is, medications may be used to start labor, or a type of surgery known as dilation and evacuation may be carried out, which is a surgery you go under general anesthesia and they will go in and clean everything out because the baby has no signs of life. So they'll go in there and clean everything out. You will bleed afterwards. I'm not really sure how long you will, but you will bleed afterwards for a while. So you'll need to wear pads. Women following a stillbirth, women are at a higher risk of another one. However, most subsequent pregnancies do not have similar problems. Depression, financial loss, and family breakdown are known complications. Worldwide in 2021, there was an estimated 1.9 million stillbirths that occurred after 28 weeks of pregnancy. So that's 1 out of every 72 births. More than 3/4 of estimated stillbirths in 2021 occurred in sub-Saharan Africa and South Asia, in South Asia, with 47% of the globe total in sub-Saharan Africa and 32% in South Asia. Stillbirth rates have declined, though more slowly, since the 2000s. According to UNICEF, the total number of stillbirths declined by 35% from 2.9 million in 2000 to 1.9 million in 2021. It is estimated that if the stillbirth rate for every country stays at the 2021 level, 17,005 million babies will be stillborn by 2030. So again, we talked about causes. Okay, so these are risk factors. Bacterial infection like syphilis, malaria, birth defects, especially pulmonary hypoplasia, chromosomal aberrations, growth restriction, intrahepatic cholestasis of pregnancy, maternal diabetes, maternal consumption of recreational drugs such as alcohol, nicotine, etc., or pharmaceutical drugs contraindicated in pregnancy, post-date pregnancy, placental abruptions, physical trauma, radiation poisoning, Rh disease, celiac disease, and female genital mutilation. So fetal death in utero does not present an immediate health risk to the pregnant woman, and labor will usually begin spontaneously after 2 weeks, so the pregnant woman may choose to wait and bear the fetal remains vaginally. After 2 weeks, the pregnant woman is at risk of developing blood clotting problems, and labor induction is recommended at this point. In many cases, the pregnant woman will find the idea of carrying the dead fetus traumatizing and will elect to have labor induced. Cesarean birth is not recommended unless complications develop during vaginal birth. How the diagnosis of stillbirth is communicated by healthcare workers may have a long-lasting and deep impact on parents. People need to heal physically after a stillbirth just as they do emotionally. In Ireland, for example, people are offered a cuddle cot, a cooled cot, which allows them to spend a number of days with their child before burial or cremation. Some hospitals have cuddle cots as well in the United States. In a number of locations, including some states in the United States, physicians will refuse to extract the body of a stillborn fetus as it is considered an abortion and therefore illegal in those jurisdictions. Which makes no sense, because if the baby's already gone, you have not terminated the pregnancy. You know what? Look here. All right. We're not going to get on a roll with this. However, I know that probably all the women watching this video will agree. Whatever goes wrong with a pregnancy, and I'm very firm about this, and I'm trying really hard not to get angry, okay? I'm trying to keep it cool. Whatever goes on with a woman in her pregnancy is supposed to be between her and her doctor. It is not supposed to be between her, her doctor, and politicians. Stay the fuck out of it. Y'all need to stay the fuck out of it. This is between her and her doctor. Her doctor is licensed by the state. Okay? They're licensed by the state. So they busted their chops. They busted their ass to get their MD license. And then somebody's going to push their knowledge and them out the way. We're going to tell you what you're going to do with your patient. Look, I'm not going to get started on that, but that makes me angry because it's none of their fucking business. That makes me very angry. If they have a legitimate medical license, why are you sticking your nose in women's reproductive business? I'm not going to get started. I really am not going to get started. So there was a lady, and I am not a physician, although I did have a licensure as an emergency medical technician, and I helped deliver babies, and I helped the moms deliver. I took care of moms afterwards. I took care of the newborns, gave them their first baths, which was a lot of fun, cuddled them, which was a lot of fun. And I was going to go to school for midwifery instead of EMT, but Missouri did not have a midwifery program at the time, so I was unable to do that. And then considering how my health took a turn for the wacky worst, I would not be able to be, you know what I mean, like a midwife, and my patient is in labor indefinitely with my body in chronic pain. That's just not going to work. And babies come when the freaking hell they feel like coming. So, yeah. There was a lady who, and she didn't know. She just didn't know. But this is a warning. If you have anything weird going on during your pregnancy, bleeding, cramping, severe headaches that get worse every single day, that could be preeclampsia, when your blood pressure is going through the roof, and that is dangerous. Okay, anything weird, anything that you sense is weird, even if you think I shouldn't go in because they're going to be like, oh my god, first time mom, she's having a cow, she's going to be so dramatic about every little thing. Who cares what they think? You go in and you go see your doctor, because it's better to be safe than sorry. Okay, so there was a lady on YouTube who had severe headaches for, oh God, for several days, and she was pregnant, and her headaches got worse and worse and worse to the point of nausea. And she had to be hospitalized, and hold on a minute. She had to be hospitalized, and she eventually lost her baby. So anything that goes weird, any severe pain, even weird pains that, bleeding, cramping, weird pains, anything that you think is odd or makes you uncomfortable, please contact your doctor, because it's better to be safe than sorry. So preeclampsia, there may be no symptoms. High blood pressure and protein in the urine are key features. Let me give that back to you again. High blood pressure and protein in the urine are key features. There may also be swelling in the legs and water retention, but this can be hard to distinguish from normal pregnancy because women have that anyway when they're pregnant. But anything that you're not sure about, again, contact your doctor. People may experience high blood pressure or fatigue. They may also experience blurred vision, headache, nausea, swelling in the extremities, or weight gain. Actually they say 3, but they're saying more than 3. What? The early signs of preeclampsia are severe headache, vision problems such as blurring or flashing, pain just below the ribs, vomiting, sudden swelling of the face, hands, or feet. And in this young lady's case, who I saw her story on YouTube, she had massive headaches. No swelling of any kind. That was no swelling, but major headaches. Now I'm going to say something else that makes me mad. For those of you medical professionals who are rude to someone who lost their child or is in the process of losing their child, it's time for you to get a career change. It's time for you to get a career change, because this is one of the worst things a parent can go through. And they remember that you were rude to them, and they always remember that you were short with them. How would you like someone treating you like that? This is just basic common god dang sense. How would you like someone treating you like that? If you were so burned out on the job that you treat somebody in horrific emotional pain like, whatever, your ass needs to get a career change. Maybe McDonald's, would you like fries with your order? Because no one should have to put up with that shit from you or anybody else. When they are going through the worst time in their life, they don't need your pissy attitude on top of it. I can't stand that either. I was very protective of my patients, and I was not going to allow anybody to be hateful. Okay? Thankfully, none of the nurses or anybody I worked with was hateful to my patients. You must have lost your goddamn mind up in here. Especially in a situation like that. You must be out of your damn mind. Consider a career change. Nobody needs that from you, especially during that period in their life. They don't need that grief from you. They don't need it. How dare you? Ooh, don't you get me started. Anyway, so like I said, women who have had stillbirth, you think you're alone, you feel alone, you know logically that other women have been through it, but when you're going through it, you still feel alone. You're not alone. This happens a lot. Some statistics, I can't talk. Some statistics say 1 out of every 4 pregnancies. It may be higher than that. We don't know, right? And frankly, I don't think there's enough studies on it, because I saw information from, 2021, 2023. I mean, I realize we just started 2024, but I don't know. I just get the impression that there's just not enough studies done on that. So the good thing is, hopefully in the future, there will be more information about it. There are chromosomal differences, abnormalities that occur. This does happen. You have no control. Come on. You have absolutely zero control over that. You are a superhero because you can take care of children, the children that you have and the children that you'll have in the future. And honey, I don't have half the patients you have. So you are a superhero, but you're not the type of superhero that can, determine what happens inside their body. You know that logically. So I don't want you to feel guilty. You got to lose the guilt. Lose the guilt. This is nature's way of eliminating a problem. And I know that sounds harsh, but unfortunately, that's the reality. And then some make it to term, and those babies will have problems for the rest of their life because of those issues. They did not succumb to those abnormalities. They went to term, the mom went to term, and the baby will have those issues forever. Don't give up. I don't want you to give up, and I don't want you, like I said, I can't say it enough. It isn't your fault. Please lose the guilt, because it's not, you have no control over that. You can't control chromosomal abnormalities. You don't have any control over that. You don't. You'd be real rich if you had control over that. You don't have any control over that whatsoever, you know. Um, you just don't. You just don't. And you can always talk to your doctor, because I know that doctors will do this. You can ask them to test, the remains, and find out, have them do testing to find out what caused it. One lady on YouTube, the reason why one of her babies did not survive, her fetus didn't survive, is because they did testing, and they found out that her baby had trisomy 18, which is it is not compatible with life. And if I'm not mistaken, that is also a chromosomal issue. Let me see. Trisomy 18. It's also called Edwards syndrome. It's a genetic condition that causes physical growth delays during fetal development. So it's a chromosomal condition. It's just not it's not compatible with life. And her second, she had a total of 3 miscarriages, and then she did go to an IVF and a fertility specialist, and I think they might have had their rainbow baby, but I'm not sure. But it's common for people to have a completely healthy baby at some point, but they needed extra help because they kept having, miscarriages. I like that women are coming forward with it, so it can basically lose the guilt, lose the shame. Um, it helps other women. It's an emotional thing. I avoided doing this video. You just have no idea. It's hard. I mean, it's hard to talk about, but it needs to be talked about so women don't feel alone. you know. Um, and I'm here to tell you, look here, look at my face. If at any time you are seeing a doctor that you don't feel comfortable with, or they're short with you, this is your OB, change doctors. Get rid of them. If they don't want to do their job, they don't have to do their job. You find somebody who you feel a connection with. So God forbid something happen, you already have a connection from the start. Because I've heard stories about women being treated like crap after they lost their child, and that is unacceptable. That is 1,000,000% unacceptable. So if you don't feel comfortable with your doctor, get rid of them. I'll get rid of a doctor in a heartbeat. I don't have, look here, I ain't got time for it. You don't want to do your job? No problem, you're fine. It's just that simple. Nobody can make you do your job. And like I said, the last thing a person needs, parents need, is to deal with someone being short with them. We're not going to tolerate that, okay? So social media is a great platform for women to come forth. They're very brave to share their stories. It's hard, and they're just putting their heart on the line when they're expressing their deepest pain, but it helps other women know they're not alone. You're not alone. You are so not alone. Okay? You are so not alone. You're not. You're not. Unfortunately, you're not. So, I went to the wake of the one baby that we lost on the OB ward, and that was the baby that all the organs were on the wrong side. That was my first time doing that. It'll always be in my mind. Like, I'll never forget that. You know what I mean? I don't think about it very often. But lately, I've kind of fallen into the stillbirth hole without a bottom. So I see this video, and then it brings me to another video, which brings me to another video, which brings me to another. You just fell into the vortex. Okay? But it is a good thing that women are talking about it. It is a good thing that they don't feel like I have to deal with this in silence, because you don't need to deal with that in silence when we have so many social media outlets that are, a trusted source to, say exactly how you feel, what you went through, what's normal and what's not normal. Um, some doctors will, one lady, her doctor did do she requested a cesarean and the doctor was okay with that. Another, so they'll either do, some doctors, not all, in case of a stillbirth, um, some doctors will allow a C-section or a D&C, which you go under for. It's a surgery. So you don't have to go into this long, horrific labor just to have, you know, the baby not be the reward at the end, as so far as alive. You know what I mean? You don't have to go through that. And the other option is cytotech, which you can take it orally or it can be inserted vaginally, and it will open up the cervix and start kind of kickstart the labor. So it's totally up to you and your doctor and what you feel the most comfortable with. Um, and like I said, you can request that they do tests on the fetus to find out what went wrong. And sometimes there's no answers at all. They just have no idea. And other times they can find out exactly what went wrong. So went wrong. And so, but you guys, you're stronger than you know. You really are, because we go through pure hell. Women go through pure hell. And what do? We hold up everybody else. And we console everybody else. And we hold up the family. We hold the family together. And in the rare, I don't want to say rare because this is not rare. In the situation where the mother is a single mother, because that's a common thing in the United States, she takes care of everybody. Everybody in the family, even her extended family, takes care of her children, her parents, her grandparents, or whoever. We are stronger than we give ourselves credit for. Okay? We need to give ourselves more credit, And men will say all these horrible things about women and whatever, but who do you think keeps the family together when you skip down the road? Now, I will say, for the videos that I saw, because like I said, I got sucked into this vortex of, these babies that were stillborn. They were all very fortunate. Their husbands were very loving and very, very supportive. So I was grateful that they had loving partners, because I'm pretty sure that's not always the case. So I knew that she didn't have to deal with it by herself, because her partner was in it with her, and they grieved together and, stuck together. So times like that will either rip you apart as a couple, or it'll bring you closer together. Hopefully it'll bring you closer together. Don't shut your partner out. If you're the mom and you're in this situation, you have to remember that your partner is suffering too, because that was their child too, right? So don't isolate yourself, pull yourself away, reach towards each other, help each other through the pain. Don't ignore your partner just because they didn't carry the partner. If they're a healthy partner, they love that child too. So that hurts them deep in the core of who they are too. So help each other through it, okay? That's the best way to handle it. All right? You guys take care. Much love, and talk to you next time.